Australia is ranked as one of the fattest nations in the developed world, a fact that our hospitals are all too aware of. Now, one in Sydney's southwest is leading the way in dealing with the problem, meeting the needs of oversized patients while cutting back on staff injuries.
It's all about making life easier for nurses and patients. This ceiling hoist is one of more than 30 at Liverpool Hospital.
I found it quite comfortable. I didn't feel any pressure or weight.
George Bloomfield is not exactly obese, simply a volunteer during this nurse training exercise. The hoist can carry up to 500 kilograms. That's 5 people his size.
We haven't seen a 500 kilo patient here yet, but there's patients up over 400 kilos that are out there.
Then there's this, an inflatable jack that helps staff move heavy patients who've fallen on the floor.
It allows us to put patients back to bed without using like 6 to 8 nursing staff, which is difficult to round up.
By floating patients on a cushion of air, the hover mat lightens the load from 90 kilos to 2.
It reduces our injury rate. It's much easier to manoeuvre the patient and to move them from bed to bed or bed to table.
Patient beds double in size within minutes, while specially designed movers are also deployed.
The hole's 340 kilos, has all the bells and whistles, the oxygen holders, the IV poles and a bit of sun cover for the patient.
It's little wonder demand for this equipment is growing. Southwest Sydney has the highest obesity rate in the metropolitan region. In 2002, about 17% of its adult residents were obese. That's jumped to over 25% a decade later. The Blue Mountains has a 24% obesity rate, followed by the Illawarra and Central Coast at 22%, then Western Sydney. All other areas are well below the state average. It means more hospitals are having to cater to expanding waistlines, while making sure the health of staff is protected. Gabriella Rogers, 9 News.
Now to